Hey guys, and welcome to this week's case on Master Your Medics. Now, have you heard of the spiked helmet sign? Well, there is a differential diagnosis to this finding, and some people think it is a masquerader of STEMI, and others think that it is a anomalous sign suggesting a STEMI or ACS. Well, let's go ahead and take a look at this week's case and see how this patient made out. Now, this was a 65-year-old female who presented via EMS with central chest pain that radiated to her neck and back, was about, moderate in severity and was constant. Her pain was actually present for about a week or so, accompanied by nausea. And on examination, she appeared ill. She was diaphoretic, confused, and somewhat lightheaded. And her chest pain was actually worsening as the clinicians took care of her, and she was actually out there clutching her chest, bent over, sweaty, had all the signs of this being something really bad. Her vital signs were somewhat reassuring, and the first 12 lead ECG showed this. So go ahead and stop the video here and see if you can break this down and come up with what this really is showing. Now, what catches my eye mostly here are the inverted T waves pretty much across the many leads, except for maybe one and AVL. And you can see that there are inverted leads in 2, 3F, and across the anterior and lateral walls. And if you focus in on let's say lead 2, for example, what you see here is this very prominent and spiked QRS complex. That is what is called the spiked helmet sign. So what does it mean? Well, this has been described before, and it has been thought that it was actually due to intra-abdominal pathology or thoracic pathology, and possibly due to a rapid increase in intra-abdominal thoracic pressures. It was also seen in cases with intracranial hemorrhage, sepsis, and metabolic derangements. And don't forget, this includes hyperkalemia, because hyperkalemia can present with anything. And so I've certainly seen things like this in cases of hyperkalemia. Now, this pattern has been thought to be a masquerader of ACS or STEMI, but the question comes up is, can it actually be something that describes a STEMI in progress? So, let's go ahead and take a look at this ECG. Now, this is the same patient that presented about 20 minutes prior, and paramedics got this ECG showing this very classic finding that we're all used to. And the patient actually, and this was actually done before the patient had the 12 ECG that showed that spiked helmet sign, showing all these changes. Here we see, significant elevations in the inferior leads with reciprocal changes in leads AVL and limb lead 1, along with ST elevations in both the anterior and lateral leads. So the patient actually had, a significant disease all, in the inferior, lateral, and anterior territories. And so spiked helmet sign, well, what does it mean? Well, you know what? It very well and should be considered a sign of ACS or a STEMI in progress. So that's it for this week. A short case, but I think a really important sign to kind of lock into our memories. Thanks for joining me. And as usual, post me with, email me with any questions that you might have. And we'll talk to you again next week. Thanks for listening.